Hey guys, welcome back to my YouTube channel. In today's video, I'll be talking about different pandemics that have happened in the past which were very similar to the coronavirus. All three of these viruses happened in the 20th century and all of them were very deadly. First up is the flu pandemic of 1918. This pandemic lasted for 2 years, and during that time it tore across the globe and infected nearly 500 million people. The death toll was between 20 to 50 million. The virus infected people of all ages, ranging from 5-year-olds to 65 years and older. There was no vaccine or antibiotic to treat the virus, because of which it kept spreading. People still took measures such as isolating themselves and good personal hygiene, but it was not of much help. Second is the Asian flu. This virus started in China in 1956 and ended in 1958. It spread to various parts of the world, such as to the USA, and killed nearly 2 million people throughout the world. The third virus was known as the Hong Kong virus. In 1968, there was a flu pandemic that started from Hong Kong, China and spread throughout the whole world. This pandemic lasted for a year and killed 1 million people. The virus started from China, then spread to Vietnam and Singapore. In just a few months, it had reached countries such as the USA. This virus had the exact same effect on the world as the coronavirus. There was not enough space to store dead bodies, and they had to put in subway tunnels and garbage collectors buried them. Just like with the coronavirus, most of the people that were infected were the elderly.
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, From what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water, or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus can change. Please check the websites below for the most up-to-date information.